Yes, welcome to Module 1 of HEAL. My name is Dr. Izie Allison-Omoruyi. I'm a GP lifestyle medicine physician, and we are here to look at vascular health equity in heart disease, diabetes, and stroke. So how do race and ethnicity play a role in heart disease and in stroke? We know that minority communities like Black adults, 47%, that's a high rate, they face a higher heart disease burden due to different social factors that we're going to be looking at later, as compared to the white counterparts, 36%. And these include limited access to resources, quality education, which is so significant, healthcare, and safe living environments. The amount of salt also that is involved in our food cooking, which is driven by common food enhancers, and these all contribute to high blood pressure disparities among Black individuals. So let's look at high blood pressure, stroke, heart disease, and kidney failure. We know that these diseases are very common in the Black community, and they face a higher risk as high as 59% among most of the ethnicities. Increased risk, Black people in heart disease, stroke, organ damage, which means every organ in your body is affected when you have these diseases: heart failure, kidney failure, and stroke-related deaths. So it's not just about having the stroke. Once you get a stroke, a lot of different things can potentially happen to you and increases your risk of dying. These trends persist in the UK and in the global Black diaspora, which means that wherever you go in the world and you find Black people, they are trending with these diseases and these risk factors. Let's look at diabetes. Diabetes harms blood vessels in kidneys, in brain, and in the heart, which means that diabetes is a multi-systemic, multi-organ, multivascular disease, which means it affects every organ in the body, every vessel in the body. So we have to be very careful. It's not just diabetes. When you get diabetes, everything's going to go: your eye, your foot, your kidneys, your heart, everything. And it also elevates bad cholesterol. It doubles the risk of having a heart attack and stroke risk. Unhealthy lifestyle choices contribute to nearly half of premature deaths. And we know for a fact that positive changes like exercise, healthy diet, and quitting smoking significantly reduces the risk of heart disease. So how does lifestyle changes affect the prevention and management of heart disease and stroke? We know for a fact that a variety of healthy behaviors make up a healthy lifestyle. And there's a very lovely acronym that you can remember very easily. ABCDE is one of the ways to think about heart disease, stroke risks that are associated with lifestyle changes. What does this mean? That these things are going to increase your risk of getting heart disease and a stroke. So the first one is alcohol. I don't think there's an easier way to say it. Alcohol, if you drink alcohol, you need to plan to stop, because alcohol causes a lot of problems. And blood pressure, the plan is to reduce your blood pressure. People have moved from taking 2-3 medications to taking absolutely none. Cholesterol, bad cholesterol, you need to drop your cholesterol levels, because this increases your risk of heart disease and getting a stroke. Diabetes, like we've already said, diabetes is one of the chronic illnesses that you can actually treat and heal and reverse by healthy living, healthy lifestyle changes, diet especially. We also need to control our diet. We need to eat more whole foods. We need to eat more plants. We need to eat more fruits, more vegetables. We need to drink more water. We need to reduce the amount of processed foods that we eat. And we definitely need to exercise, which is the last point. Exercise is so essential. You need to focus on what you can do and do it consistently. So these are some of the examples that you see on the shelf. These are like good healthy choices that you can make, that you can bring into your home and begin to use on your daily. That will make a massive difference. So what's the impact of systemic racism on cardiovascular health outcomes among Black people? So here are some of the ways that systemic racism can affect cardiovascular health among Black individuals. Number one, access to healthcare. Access to healthcare, depending on where you live, will depend on the kind of healthcare that you have access to. Socioeconomic disparities, depending on how much money you earn, depending on the level of education you have, it would affect the amount of health access that you have. access to nutritious food. We know that plants, organic, grass-fed meats, organic foods are expensive. And, it's so easy to go down the cheapy shop or just go down to one of these cheap shops and buy something processed. But good food is expensive. So the more you earn, the more you have access to these things, and we begin to reverse this systemic racism that seems to be eating deep into Black people. Lack of representation in clinical trials. We also know for a fact that more of these clinical trials are done in Caucasian individuals than in Black people. Generational health. So yes, disease runs in families, but also habits runs in families. So in conclusion, to tackle disparities, we need policy changes. Policies need to change in favor of Black individuals, improved healthcare in the communities where the Black individuals live, community engagement. People need to come out and begin to engage in society and speak up. Education, the more you know, the more you can question things, and the more you can begin to demand things, or not even demand, like seek for things to better yourself and fight systemic racism. Thank you very much.